Hi, I'm Dr. Eileen Yager. I'm a pediatrician at the University of Colorado Medical School. And back in 1990, I was on the founding faculty of the UCLA Pediatric Pain Center, and Dr. Lonnie Zeltzer was my boss then. As you know, many people carry tension in their neck area and shoulder area. And today we're going to do some exercise to relax the neck muscles. This is a wonderful practice that I have been doing and teaching for many, many years. It's short and it really works. Sit. This is best done when you're sitting. So sit with your legs uncrossed and rest your arms either on the arms of the chair or on your lap or on something convenient like a tabletop. And look straight ahead. Tune in to how it feels in your neck and upper shoulder region. Is there tension? Is there tightness? Does one side feel lopsided compared to the other? So keep your head straight for starting. Okay. Now the first thing is to tilt your head so that your right ear is down towards your right shoulder. And do this whole practice gently. If you do it too hard, you may end up getting Charlie horse. But if you do it gently, it's wonderfully relaxing. Okay, so when you do this, you may feel it pulling on the side here. Now what we're going to do is rotate our heads forward, facing forward, bending the neck, rolling around so that you end up looking over your opposite shoulder. And we'll do it together. When you get to the center, turn your chin so that you are looking at your left shoulder and you end up looking over your left shoulder. Then you will go back again. So let's do that now. Ear to shoulder, and then slowly turn your head, bending your neck down. When you get to the center, start to look to your left so that you end up looking over your left shoulder. Hold for about 2 or 3 and then go back again. Then make sure you bend your neck and swing slowly. Now center, start looking over your right shoulder to the right. Okay. Now, we'll do this several times, but before, I want to just mention that as you swing your neck, if you do have tension in that area, there are times where it may pull in the back of the trapezius muscle, either one side, both sides, center. If it hurts when you do this, then stop rolling, stop rotating your neck, hold that posture so you feel it pulling on the sore spot gently, and count to 5. And then you start rolling, continuing along again. Okay. Now what we'll do is 3 times back and forth, and then sit quietly. You may do this with your eyes open or closed, it doesn't matter. You can try it with both and see which you like better. Okay, start with your right ear to your right shoulder. Roll around. Now I'm going to stop right here because there's a sore spot in my trapezius muscle. Hold for the count of 5. And continue rotating the neck. Look over to the left side after you pass the midline. And when you get to the maximum, hold it for the count of 2 or 3. And then go back. The sore spots may not be exactly the same in the different directions, but it does help when you stop and just hold for the count of 5 in any sore place, because stretching the muscle longitudinally helps it to relax when you stop the stretch. Okay, so that's one complete cycle, over and back. Now we're going to do it the other way. Put your left ear down to your left shoulder. And again, you may feel it pulling on the right side. And now swing slowly forward. At the midline, you start to turn your chin to the right, and you end up looking over the right shoulder. Now count to 2 and go back again. Turn to the left when you get to the midline. And over. Now we'll just keep on doing this for 2 more cycles. Make sure you end up looking over the opposite shoulder and start switching in the middle. We'll do 1 more cycle. Make sure you do it gently. Don't force anything. Okay. And now back to the midline. Sit up straight. Rest your arms comfortably on your lap or on the chair. And tune in to how the area of your neck and shoulders feel. Keep your head upright as you do this. And it's a good idea, I think, to keep your eyes closed when you're tuning into your body. But if you prefer to do it with eyes open, that's fine. And always sit for 30 to 60 seconds after you finish any practice before you jump up and go to your next activity, because it's very jarring to your system if you don't allow your body to just be calm and absorb what you've just done. Breathe at a natural rhythm. And again, this is a safe practice. You can do it, you can repeat it as many times as you need to, except not when you're driving. And you may try it with your eyes open, with your eyes closed, see what you like better. It's okay to teach it to your child or children, and it's okay to teach it to other adults because this is a safe practice. Now you notice we only stay in the front. I don't rotate to the back. That's not a good idea because you may hurt your bones. And one other thing I wanted to mention is that as you do this practice, sometimes you'll feel or hear a creaking or clicking in your neck. Don't worry about that. It's a natural thing, just like when you click your fingers, you snap your fingers and sometimes they make some noise. Unless there's pain, then stop the practice right away, but that shouldn't happen. But clicking or hearing crunching noises, grinding kind of noises is normal. It does not mean you have arthritis in your neck. And just continue doing the practice gently. Okay. This is a wonderful practice. I really like it. Thank you for coming. Bye-bye.